Welcome folks! Today's video delves into the misuse of Adderall, the risks of amphetamine overdose, its various side effects, and the medical strategies for managing these challenges. Let's dive in. It's past midnight and you've written only one sentence for the 5-page paper you have in a few hours. You haven't even started looking at your notes for the big test. Then you realize that your coffee supply is running low. It's the most dreaded week of the year, finals week.
Hi, how are you?
I'm good, and you?
I'm a bit stressed, so I called in to ask you if you started studying for the finals yet.
Finals? It's way too early.
Early? We have 1 week to study for the finals and we have 6 exams.
Look, when I'm drowning in deadlines and coffee isn't enough, I turn to my smart pill.
Huh? What's a smart pill?
I use it during the day so I can get everything done on time, and then at night I can sleep and ace my exams. Why don't you try it out?
I don't know about that.
Look, it's just like coffee or an energy drink, but in a pill. Plus, when I used it, I got the best grade of my life on an essay. Besides, $5 for one 30mg pill is a very cheap price to pay for a good grade. I'm on campus if you want to try it out. We could meet near the parking lot.
See you.
After these two friends decided to use Adderall for their exam, Sebastian starts to feel symptoms of an overdose. He starts feeling chest pain, palpitations, and anxiety. No one was there to help him as everyone was busy with their exam. So Adderall is a prescription medication used for ADHD or for attention deficit hyperactivity disorder. This medication is a stimulant and is prescribed as a type 2 scheduled drug by the FDA and can cause serious addictions. If it was used for other purposes besides ADHD, it can cause symptoms similar to cocaine.
Let's talk chemistry. The phenylethylamine structure of amphetamines is similar in functions to epinephrine, dopamine, as well as serotonin. In comparison to cocaine, effects of cocaine last for 10 to 20 minutes. However, the duration of amphetamine action is much longer. It lasts for around 10 to 12 hours. What are the short-term effects of amphetamine overdose? The short-term effects include seizures, hypertension, tachycardia, hyperthermia, stroke, and even death can occur. Whereas in terms of the psychological effects, psychosis may happen, hallucinations, as well as anxiety can occur. Regarding the long-term effects due to habitual amphetamine uses, include psychosis again, resembling paranoid schizophrenia.
Hello, how are you?
Hi, sir. Welcome back. Do you need anything?
Yes, I came in because I wanted some vitamin C pills, if you please.
Are you okay, sir? You don't seem like usual.
Yeah, I'm alright. It's just I have been taking some amphetamines now and then in order to focus on my exams and study.
Okay, I advise you to stay away from these medications because regularly taking these drugs will cause tolerance and dependence, and this will affect the leading to addiction, and this will affect your social, mental, and physical health. Amphetamines are used as diet pills for weight loss if used chronically. I will refer you to the addiction center.
Let's talk about addiction. Addiction to Adderall is a serious concern to society. The stimulant properties of Adderall can leave patients with dependency, feeling like they need Adderall to function normally. Long-term use of Adderall can lead to tolerance, where patients would need higher and higher doses of Adderall to reach the same effects. This can lead to addiction, which can manifest as cravings, withdrawals, and the inability to stop use. Thus, it is vital to recognize these signs early on and to seek professional help. As pharmacists, we play a very important role in educating patients about the risks associated with Adderall use. Furthermore, schools and universities must perform their part in informing and educating their students about the risks associated with Adderall, such as addiction and others.
The treatment of amphetamine overdose. The treatment can start at a pre-hospital care and then can later be escalated to the emergency department care. In the pre-hospital, the treatment should be focusing on the complications, including seizures, loss of competent airway, cardiac dysarrhythmias, and trauma. And after that, in the emergency department care, GI decontamination is very important. It can include activated charcoal or gastric lavage. For bowel irrigation, it may be indicated in large quantities of amphetamines only. And in case there is agitation or seizures, benzodiazepines are the drug of choice. In case there were cardiac dysarrhythmias or hyperthermia, admission is required. Stable vital signs has to be corrected, whether that be hyperthermia or hypertension, tachycardia or dysarrhythmias. When the patient presents with a chest pain, cardiac infarction has to be ruled out before continuing on with the treatment. And if the patient was taking this medication for the intent of suicide, then the patient has to be referred to a psych ward or a psychiatrist.